living in filth and squalor. Yes. Yeah, I mean, being the victim of a crime. We know that homeless people, if they're living in a tent or out uncovered, they're more likely to be the victim of a crime, which is very serious. I mean, there's dying on the streets. I mean, there's a lot of things I can think of.
Knives, guns, all those things.
All of that, yeah. So, I mean, if you're like, I don't know, a regional homelessness authority that's tasked with helping the homeless, those would all be kind of top priorities, you know, getting them into shelter, generally speaking. Or if you're the King County Regional Homelessness Authority, you could be focused on making sure that they don't get COVID. This segment is brought to you by Eastside Weight Loss Clinic. Sick of fad diets that work for a couple months and then you gain all the weight back? Well, I'm down 37 pounds on the Eastside Weight Loss Clinic program, and I've kept that weight off for more than a year. Schedule your free 15-minute consultation today at eastsideweightlossclinic.com. You could be focused on making sure that all those homeless people living out there in filth and squalor and around needles and drugs and crime, that they at least die on the streets with a mask on their face. That's the key.
And with gloves.
Let's be clear Important. Here. Like, if they're going to die in their tents with a fentanyl needle between their toes,
they have a test handy.
That they can test themselves for COVID-19
before they do fentanyl.
Yeah, before they do fentanyl, and so they don't spread it, you know, because it's such a sterile environment that they would want to make sure to isolate, right? Yeah, the King County Regional Homelessness Authority, all the things that they have on their plate, all the failures, increased homelessness, this is what they're focused on. They tweeted out, 39 local organizations have received COVID-19 mitigation supplies thanks to partners with the Department of Health and King County Public Health. We love seeing our community work together to keep the most vulnerable among us safe and healthy. They have distributed, this is their final distribution numbers that they're just now sharing, 11,000 N95 masks, 4,000 COVID-19 tests, 83,000 pairs of exam gloves, which I'm sure were used to examine themselves for COVID-19. What's this for? I don't understand.
To handle their tests.
3,000 bottles of hand sanitizer. Now that one I think could go a long way.
Yeah, no, I'm for that.
This is stupid. This is genuinely dumb. You have and it's insulting to the homeless population, frankly. I know we're kind of laughing. Can you think of something dumber than handing a homeless person who's about to OD on fentanyl a mask and say, stay safe and healthy? These are hundreds of millions of dollars go to this homelessness authority every single year since it started. They want more money. They've asked for their budget to be increased. Homelessness in King County increased 20% year over year. Why do you think so? Well, because they're out there patting themselves on the back for giving homeless people who are dying in filth and squalor and drug addiction a mask and hand sanitizer and saying, good luck. One of the dumbest things, that's saying a lot. One of the dumbest things I've ever seen them tweet out. Like, had this been, and I'm sure they were doing this during the height of the pandemic, and I don't think we would have made fun of it so much then. But the fact that even $1 is going to handing a homeless person a mask when you should be giving them your hand and saying, let's get you off the street and let's get you into shelter and let's make sure you're not doing drugs and dying or the victim of crime out here. It's so utterly laughable. I don't even know what else to say about it.